Thank you for choosing Henry Mayo Newhall Hospital for your total joint replacement. Welcome to our preoperative education video. Coming into this procedure, you may be dealing with chronic pain and limitations in your lifestyle and movements. Our commitment to you is to help you achieve your personal goals, including regaining an active lifestyle through education, quality improvement, and delivering your care in the safest way possible. We highly recommend watching today's video with a family member or a friend, preferably the person who will be assisting you the most after surgery and your recovery. This way you are both receiving the same education. In our class today, we will be covering several objectives, including understanding your procedure, what to expect during your hospital stay, how we manage pain, including multimodal therapy, how to prevent the most common complications after surgery, physical and occupational therapy, how to prepare for surgery and for going home, and how to properly care for yourself at home. You will be working with a nurse navigator during your total joint replacement journey. This is a registered nurse that is responsible for your preoperative education. They will also oversee your team and your care while you're in the hospital. They are there to ensure that you have a smooth experience, including addressing any concerns you or your family may have in real time, making sure that you are ready for discharge, including making daily rounds while you're in the hospital, and they will also be checking in with you periodically once you are discharged to make sure you are doing well at home and answering any questions you may have during your recovery. You are in the driver's seat on the road to your recovery and therefore have the most important role. Our program is designed to give you the necessary knowledge and tools to help you navigate a successful recovery and help you regain your quality of life. At the end of the day, you will get out of it what you put into it. If you have not done so already, we would like for you to think of some goals for yourself. Short-term goals could be a few weeks to a couple months after your surgery, and long-term goals may be several months to a year out. Some examples might be decreasing pain, walking longer distances, having more active time with family. Whatever they are, they're things that are important to you. We are here to help you achieve these goals and help you improve your overall quality of life. Having measurable goals helps you have something to work toward and track your overall progress. Next, we will be talking about the different types of total joint replacements, including knee, hip, both anterior and posterior approach, and shoulder. The most common cause for needing this procedure to be done is arthritis. This is a condition that causes the natural cushioning between joints, called cartilage, to become worn away, resulting in pain, stiffness, swelling, and sometimes bone spurs. In this picture, starting at the left, you can see a knee that has damage due to arthritis. During your procedure, your surgeon will start by removing the damaged cartilage and small portions of bone to help prepare it for the implants. The surgeon will custom fit these components based on your anatomy to recreate the surface of your joint. Looking at the picture on the right, you will see metal components placed on the bottom of your thigh bone, on top of your shin bone, as well as a plastic spacer in between to create a smooth gliding surface. Some surgeons may also reshape or resurface your kneecap with a plastic button. This will depend on your specific anatomy and activity level. Following your knee replacement, there are a few things to keep in mind. First of all, do not be afraid to bend and straighten the knee. This is going to be part of your recovery. In fact, you will be up and walking and bearing weight on your brand new knee within hours of your surgery. The only restriction that we may have is not placing anything such as a pillow behind the knee. Instead, what we may have you do is use a rolled up towel or a pillow behind your ankle to help provide you with extra extension and help you practice straightening the leg. Prior to your surgery, due to the arthritis, you may have noticed stiffness and difficulty with bending and extending, sometimes causing you to walk with a limp. After surgery, we want to try to regain as much of range of motion in your knee as possible. The most difficult thing may be stretching out those tendons and ligaments behind the knee since they have been stiff for so long. This is why we want to practice stretching. The hip joint is a ball and socket joint. The top of the thigh bone is the ball, and the pelvic portion of the joint is the socket. Arthritis causes damage to the cartilage and bone of this joint. The surgeon will start by removing the head of the thigh bone and replacing it with a metal stem that is inserted into the thigh bone. The inside of the socket is cleaned out and replaced with a new socket to allow for a smooth gliding surface. These components will be custom fit based on your size and anatomy. For a hip replacement with a posterior approach, this means that the incision is made toward the back and side of the body. The surgery comes with activity restrictions to help protect the joint from dislocation as it heals. These 3 precautions are usually in place for a period of at least 3 months or as directed by your surgeon. As you can see pictured, starting at the top, the first precaution is no bending past 90 degrees or an L shape, meaning that the knee should be staying below the level of the hip. The second precaution is no twisting your leg inward or pigeon toes, meaning we want the hip and knees and toes to stay in a line. Lastly, no crossing your legs, whether at the knee or at the ankle. For a hip replacement with an anterior approach, this means that the incision is towards the front of the body. With an anterior hip replacement, there are also precautions to follow. The duration of these precautions is up to the surgeon. The reason that these precautions are in place is, again, to help prevent dislocation of the hip. The following precautions are to be followed: no bending backwards, no pushing the hips forward or bridging, no lying face down, and no twisting of the leg outward. Moving on to a shoulder replacement. In the first example pictured, you can see a normal shoulder joint, which is comprised of your shoulder blade and the bone that makes up your upper arm. The second and third photos show damage caused to the cartilage from arthritis, as well as some bone spurs. These can cause pain and limited range of motion in the movement of your shoulder. Depending on your anatomy, the surgeon may opt for a traditional total shoulder, as pictured on the left, or a reverse total shoulder, as pictured on the right. As mentioned in the previous slide, your shoulder is a ball and socket joint. In the traditional approach, the head of the upper arm, or the humerus, is replaced with a new metal ball, and the socket portion of your shoulder blade, or the scapula, is replaced with a new socket, as you can see pictured. For patients who may have difficulties lifting their arms due to rotator cuff issues, this procedure is done in reverse, where the ball part of the socket is attached to the shoulder blade, or the scapula, and the curved socket is attached to the bone of the upper arm, or the humerus. Following your procedure, you will have shoulder precautions in place for a period of at least 6 weeks or as directed by your surgeon. This is to allow your shoulder to fully heal and to lower your risk of complications such as dislocation. Do not actively move your operated shoulder. Any movement originating from your shoulder will cause those muscles to contract, and we do not want to have any muscle power created from your shoulder. Do not lift or carry any items with your operated arm, no matter how benign or lightweight they may be to you. Do not bear any weight with your operated arm or shoulder, such as do not use your arm to push off to get in and out of a chair or in and out of bed. Do not reach behind you. Always keep your arm in a position where you can clearly see your elbow. We recommend an L shape where your hand is positioned around the area of your belly button. That way you can always keep an eye on that elbow in front of you. Following your procedure, you will be fitted for a shoulder immobilizer. This immobilizer will be worn at all times, with the exceptions of removing for bathing, dressing, and doing your passive range of motion exercises as directed. Your hand, wrist, and elbow should be supported, and we want the arm to be in the position of an L, and this is to help prevent a pulling sensation in the shoulder. Again, we don't want any active movement of the shoulder. Let's meet your team that's going to be taking care of you during your stay. You're going to have a registered nurse and a patient care assistant assigned to you every shift that will be taking care of you at the bedside. You'll also be working with physical and occupational therapy. They're going to focus on getting you up and moving, walking. They'll be going over any precautions that you might have, exercises that you can be doing, and going over how to properly use your equipment in the hospital and at home. You'll of course see your surgeon. They'll be touching base with you after your procedure to see how you're recovering. You will also have a medical provider assigned to you during your stay. They're going to oversee everything else not related directly to your procedure, such as your labs, your vital signs, your medications. They'll be the ones who will give you the all clear to be discharged, order any prescriptions or equipment that you might need to go home. Some things to expect in the hospital. We're going to be getting you up and walking that same day within a few hours after surgery, but we also want you to get up out of bed for all your meals and sit in the chair. We also want you walking and participating actively with physical and occupational therapy, and we want to make sure that your pain is at an optimal level, so that's not what's holding you back from what you need to accomplish. These are usually very short-stay surgeries, so we want to make sure that you're taking advantage of every opportunity to get up and get moving. Some things to keep in mind on what to bring with you to the hospital: your insurance card and your ID, some comfortable loose-fitting clothing that'll be easy for you to get in and out of after your surgery. If you have an advance directive or a living will, please bring a copy with you so we can scan that into your medical record. Please bring a list of your medications, including the dose and how often you take it, and noting the last time that you took it. If you take a special medication that's a special brand or a special dose that we may not happen to carry, this would be called a non-formulary medication, and we may ask you to bring that medication with you to the hospital. Otherwise, your medications can stay at home, and just bring your list. Please leave your valuables at home, as we have nowhere to store them in the hospital, and we don't want anything to get lost. Please do not wear any metal products such as hair clips, bobby pins, or jewelry. Please do not wear contact lenses the day of your surgery. And if you're needing corrective lenses, please bring your glasses if necessary to sign papers. If you have sleep apnea, you're welcome to bring your CPAP or BiPAP machine with you. Also, any dentures or hearing aids that you may require. Within a few days of surgery, your surgery start time will be confirmed by the pre-surgery clinic. Expect to arrive 2 hours prior to your designated start time. You will enter through the main entrance of the hospital and head to admitting. From there, you will be directed to the pre-op area where the preoperative nurse will start prepping you for surgery. And next, you will meet with the surgeon and anesthesiologist. Continuing in the preoperative area, you'll speak with the surgeon and anesthesiologist to answer any last-minute questions you may have. Your consent will be signed and verified, and your site will be marked by the surgeon. Your health and medication history will be reviewed, and anesthesia type will be discussed. There are a few different types of anesthesia to be considered. General anesthesia is the type you may already be familiar with. It's a combination of drugs that put you in a sleep-like state so you're unconscious and don't feel anything. Spinal and regional anesthesia focus on using medications to target pain receptors either through the spine or directly to the nerves to provide you with pain relief after surgery. Based on your history and needs, a specific plan will be put in place for anesthesia and pain management. Once your surgery is complete, you will be transferred to our recovery room, where you will stay for a period of about 1 to 2 hours. Here we want to make sure that you're waking up well from anesthesia, that your vital signs are stable, that you're comfortable, that your pain and any nausea or vomiting that you may be having is controlled. And once the nurse and anesthesiologist feel that you're stable, you will be transferred from the recovery room to our orthopedic unit, where you will be staying for the rest of your stay. Our orthopedic unit is on the top floor of our new tower building, known as Tower 5. Expect to get up and walk the same day of surgery. Depending on your surgery start time, you may work with physical therapy the same day of surgery, but if you are a later case, you will see them the next day. Our nursing staff will still be able to assist you to get up and walk and get out of bed, regardless of physical therapy availability. It's important to take every opportunity to get up and walk, not only to lower your risk for surgical complications, but also to jumpstart your road to recovery. Our specially trained staff will be taking care of you on the orthopedic unit. You'll have a registered nurse to manage your care, working alongside a patient care assistant. You'll also have case managers and discharge planners that will be making your arrangements as far as any equipment, home health, sometimes your follow-up appointments, and anything that you may need to help you get ready to go home. You'll be working with physical and occupational therapists that will start on day of surgery, and you'll also have a primary medical doctor to care for you during your stay. In the hospital, you'll be working with physical therapy. Their main focus is getting you up and getting you moving. They'll help you getting out of bed, reminding you of any precautions that you may have, showing you exercises that you can be doing on your own, how to properly walk and use any equipment that you may need, such as a front wheel walker, practicing stairs if you need to do so at home, and they'll make recommendations for you as far as outpatient and home health physical therapy for continuing your exercises outside of the hospital. Another type of therapy you will encounter after surgery is occupational therapy. This focuses on your day-to-day activities such as dressing, showering, toileting, and other household activities. Due to your surgery, you may have restrictions on your movements and may need to learn new ways to accomplish these day-to-day tasks. The occupational therapist will help you to learn how to accomplish these tasks and may recommend the use of some assistive devices. Once you meet with occupational therapy, they may recommend to purchase some assistive devices to help you with accomplishing those day-to-day tasks we mentioned previously. These are some examples pictured: reachers and grabbers, long-handled sponges, shoe horns. Before you go out and purchase anything, please wait until you are evaluated by the occupational therapist. If anything is recommended for you, they will provide you with the list, and these are readily available in our gift shop, online, or via medical supply stores. Now let's talk about some equipment you may see after surgery. Hip and knee patients will see a front row walker as pictured at the top of this slide. This is to aid you with walking and providing stability and support as you heal. You may also see a bedside commode placed in your bathroom. This frame will be placed over the top of the toilet to aid with getting on and off. Thirdly, a knee immobilizer may be used following a total knee replacement for some patients. If that is the case, it is to help give you support and prevent your knee from buckling. This is only to be used while you're up and out of bed. Lastly, the abductor pillow is a foam wedge pillow that is used for our posterior hip replacement patients. This is to help enforce your hip precautions we mentioned previously of not rotating your leg inward or crossing your legs. Pain is your body's protective mechanism, and it can come from injury to the skin, muscles, nerves, bones, so on. Going into surgery, you may already be dealing with some measure of chronic pain, so to come out of surgery and to have a goal of no pain is unrealistic. We want to make sure that we're setting realistic expectations. Because pain is there as a protective mechanism, we want to be able to listen to your body. Instead, our goal is to keep your pain at a tolerable level where you can accomplish your daily goals. And how we do that is a combination of pain medications, movement, and non-drug therapies tailored to you to help you with controlling your pain. In the hospital, we are going to be asking you to rate your pain from 0 to 10. That way we can get an idea of where you are at. Please see pictured for definitions assigned to each number as a reference. This is to help ensure good communication and that we are addressing your needs appropriately. As mentioned, you will have pain, but we want it to be at a tolerable level where it is not affecting you accomplishing your day-to-day activities. Looking at this scale, you can see a 10 is horrific pain that affects even your ability to communicate, which is why it's at the top of the scale. Our goal is to keep you no higher than the moderate level, which is more reasonable, where the pain has not gone completely, but you can still accomplish your daily goals. This picture is showing unrealistic expectations. Our goal in this class is to make sure that we're setting realistic expectations. So if you're coming into surgery due to pain or limited movement, it's unrealistic to expect that you'll have surgery and come out of the hospital and all of those issues will be resolved within a day or so. This slide is more realistic of what to expect. However, with continuing your therapy, walking daily, maintaining your precautions, managing your pain, and a measure of time, we can meet those expectations and get you back to that active lifestyle that you're looking for. As mentioned previously, you may have a nerve block placed by an anesthesiologist to help block your pain receptors to help give you some pain relief following your procedure. If for some reason a nerve block or spinal is not done, the surgeon may opt for an intraoperative injection. This is where they inject some local anesthetic into your joint, similar to what you might receive at a dentist's office, and this can also last for a few days after your surgery and help manage your pain. As this medication starts to wear off, it is normal to have an increase in your pain, so it's very important that we stay on top of your pain so that we don't end up chasing it. As far as medications, we use what's called a multimodal therapy, where we try to use different classes of medications to target different receptors to help adequately control your pain. Firstly, what we prescribe is extra strength Tylenol. This is given to you around the clock to help keep a steady stream of medication in your body and to help properly manage your pain. Meaning, if your pain is not that bad after surgery, we still advise you to continue taking it. That way, as your nerve block and everything starts to wear off, you still have medication in your body to help keep your pain under control. The second class of medication that we usually prescribe is in the NSAID family. This is a non-steroidal anti-inflammatory drug, which you may be more familiar as Advil or Aleve or ibuprofen. Usually in the hospital, we'll prescribe Celebrex or Toradol. Thirdly, we also prescribe something to help with nerve pain in the gabapentinoid class. That may be Lyrica or gabapentin. If these medications in conjunction with a nerve block or spinal is still not keeping your pain adequately controlled, we may also provide you with an opiate. This is to help keep your pain under control, and this is something that's as needed, so you would ask the nursing staff if you need extra pain medication. You'll also go home with a prescription for pain medication as needed. While you're using this medication at home, please make sure that you're not drinking any alcohol or driving, and keep the medications in a safe locked place away from any children or pets. The reason we take such a wide range of medications, the multimodal therapy, the nerve blocks, is we're trying to limit the amount of opiate pain medications that you're taking. There's so many side effects attributed to them, such as constipation, itching, inability to urinate, nausea, low blood pressure, and shallow breathing, that if we can control your pain without resorting to the opiates, we will try to do so. There's other things besides taking medications that we can do to help keep your pain under control. First thing that we highly recommend is getting up and moving, meaning doing your walking, your exercises, working with physical therapy. The more you're sitting and not moving, it's giving your body a chance to lock up and tighten. So the more you're getting up and moving, the more you're loosening up and helping relieve some of that tension. The other thing that we recommend is using an ice pack 20 minutes every hour to help head off any swelling and inflammation you may be experiencing immediately after surgery. You will be given an ice pack following your surgery for you to take home. We also recommend relaxation, music, distraction, things to help keep your mind off of the pain. The more that you're sitting and dwelling on it, you may not realize it, but subconsciously your body may be tensing up, and when you get up and walk, you may feel like your whole body is sore from all those muscles being tight. Now let's move on to talk about preventing complications. The three that we will be focusing on are infection, blood clots, and pneumonia. Prior to your surgery, you're going to be washing with an antimicrobial soap called Chlorhexadine to wash off the naturally occurring bacteria in your skin to help prevent infection. We're also going to be talking about how to properly care for your incision, as well as doing proper hand washing to help prevent introducing bacteria into your incision. You will also be getting a few doses of antibiotics prior to your surgery and after in the hospital to help reduce the risk for infection. Secondly, we'll be going to talk about blood clots. Blood clots occur in the big veins in your legs when your circulation decreases. The best thing that we can do to help reduce the risk for blood clot is walking. As you walk, your circulation increases and helps lower the risk of your blood pooling in those big veins in your legs. The other things that we can do are doing ankle pumps and wearing compression stockings or TED hose and sequential compression devices, which will provide a slight massage to your legs to again help improve your circulation. You'll also be started on an anticoagulant after surgery, which we will talk about in a few moments. Lastly, with pneumonia, when your body tends to take shallow breaths, your lungs do not expand, and that increases your risk for developing moisture and an infection in your lungs, which is called pneumonia. The best thing we can do to help prevent pneumonia is practicing coughing and deep breathing, and we can give you a device called an incentive spirometer, which is another way to practice your deep breathing. Also, getting up and walking helps you take better, deeper breaths because you're not fighting against gravity when you're laying down to take that big, deep breath. Anticoagulants are used to prevent blood clots. If you are already on an anticoagulant due to your past medical history, this will usually be stopped leading up to surgery and restarted after surgery. This is stopped due to the risk of bleeding. Common side effects include diarrhea, nausea, and a metallic taste in the mouth. Things to look out for is bleeding that does not stop, unusual bruising or growth in size, keeping in mind that some bruising is expected after surgery, or any blood in the urine, vomit, or bowel. After surgery, our goal is for you to go home. There's less risk for infection, there's greater comfort in the surroundings of your own home, and there's more opportunities for you to get up and walk. So what gets you home? Firstly, we want to make sure that it's safe for you to go home. As you work with the staff and physical and occupational therapists, we're going to be assessing your strength and your ability to take care of yourself. We also want to make sure that you're eating and drinking well and tolerating your oral medication, and that you're not having any persistent nausea or vomiting, and that your pain is well controlled. You may still go home with your nerve block in effect. As I mentioned previously, sometimes these medications can stay in your system for a few days. Also, we want to make sure that you're able to go to the bathroom without difficulty. Most patients after surgery will have a urinary catheter, and once that comes out, we want to make sure that you're able to go to the bathroom on your own. Having a bowel movement is not a prerequisite to go home unless you're severely constipated. Some key things to keep in mind. Remember, this is an elective surgery, meaning you are not in the hospital because you are sick. You've been properly educated and know what to expect. You're more than welcome to wear your own clothing after surgery. We will also be providing you a t-shirt from our joint department. The goal for discharge is post-operative day 1, meaning the day after surgery, and the goal is to go home. Please actively participate with physical and occupational therapy. As we mentioned before, this is a very short stay, so you want to utilize every opportunity to get up and get moving. Keeping in mind that you will have pain, but it's going to be kept at a tolerable level. Also, please make sure to ask questions so that you feel fully comfortable before you are discharged with all your pain management and aftercare instructions. Now let's move on to talk about how we will properly prepare for surgery. We would also have you make an appointment with our pre-admission testing department prior to your surgery. Here you can have any lab work done ordered by your doctor, including your COVID test, EKG, and a type-in screen. Please make sure to bring the doctor's orders with you when you arrive at your appointment. A type-in screen is a blood test that identifies your blood type specifically to you, and you are fitted with a wristband that cannot be removed until after your surgery. Also, the staff at Pre-Admission Testing Department will review your medical history, go over preparation instructions with you, and communicate any concerns to the anesthesiologist and surgeon ahead of time to decrease any delays or cancellation of your surgery. In order to make sure you are in the best shape possible for your procedure, your surgeon will have you see your primary care provider within a month of your surgery. This is especially important if you have chronic medical conditions such as diabetes, high blood pressure, or respiratory issues, as these need to be well controlled to reduce the risk for complication. You may need to check in with any specialist you see for additional clearances. Also, leading up to your surgery, we want to make sure that your primary care provider goes over your medications with you, especially if you're taking anything for chronic pain, heart, blood pressure, or seizures. Usually these medications can continue to be taken up until the morning of surgery, and you can take them with a small sip of water. If you are diabetic, please check in with your primary care doctor, as these are usually stopped or reduced and managed in the hospital with insulin. After surgery, you will normally be restarted on your routine medications. It's not only important to check in with your primary care doctor on what medications to continue to take, but also on what medications it's important to avoid, mainly medications that can contribute to your risk of bleeding during surgery. Some examples of medications include aspirin-containing products. These affect your platelets. These include aspirin, Plavix, and certain over-the-counter medications such as Alka-Seltzer and Pepto-Bismol. We usually also have you stop taking NSAIDs. Those are the non-steroidal anti-inflammatories. Please also check in with your doctor if you are taking anticoagulants such as Coumadin, Eliquis, Xarelto, and Pradaxa, as far as specific timing on when to stop taking these medications. Also, be sure to list any supplements that you are taking in your list of medications, as they also can affect your bleeding time. Some supplements that we have you avoid include ginkgo biloba, vitamin E, feverfew, fish oil, and garlic. Again, these medications are usually stopped about a week or so prior to your surgery, but again, touch base with your doctor for specific instructions. Some surgeons may prescribe you a nasal antiseptic a few days leading up into your surgery. This is because some people are a natural carrier of a bacteria in their noses called Staph aureus. And when you're a carrier of this bacteria, there is an increased risk of that bacteria turning into an active infection. This antibiotic ointment is applied inside of the nose and is to help lower that risk for infection. If your surgeon does not prescribe this to you, you will get a one-time dose the morning of your surgery in pre-op. If your surgeon does not participate in our ERAS program, Enhanced Recovery After Surgery, you will be fasting after midnight and taking any medications with a small sip of water the morning of your surgery. If you do participate in the ERAS program, this information is for you. The night before your surgery, you will eat and drink normally. Starting at midnight, you can continue to have clear liquids. That's juice without pulp, black coffee, water, and plain broth. No creamers, smoothies, or milk. The goal of our Enhanced Recovery After Surgery program is to help get you into surgery hydrated, meaning you have fluids on board, and to help you bounce back more quickly after surgery. We also want to make sure you have energy. So you're going to be drinking a special Ensure, which is formulated to be a clear liquid that's loaded with 50 grams of carbs. You're going to be drinking this at the 3-hour mark prior to your surgery. This is a strawberry flavored drink. If for some reason you don't like strawberry and you'd like to substitute it with something else, you can drink a regular Gatorade or a Powerade. At the 2-hour mark prior to your surgery, you'll have nothing more to drink. And the 2-hour mark is when you'll be showing up to the hospital for your surgery. After surgery, we also want to focus on strategies to help lower your risk for nausea and vomiting and bloating. The first thing we do is limit your use of straws. When you drink through a straw, you're also swallowing air, which can help make you feel more bloated and nauseous. The other thing that we have you do is chew gum after your meals. This is to help promote your digestion and wake up your gut. You're going to be asked to take a shower with our special antimicrobial soap called Chlorhexadine. Your skin naturally has bacteria in it, so we're trying to wash off as much bacteria as possible leading up to your surgery. Prior to taking your showers, we want you to do some laundry. Wash your clothes, your towels, and your sheets. To begin, you'll take your normal shower. After you are done doing your shampooing and body wash, you're going to apply the Chlorhexadine from the neck down, avoiding the face, and avoiding the genital areas. You're going to leave the soap on your skin for 2 full minutes, and then you will rinse off, making sure you use your fresh towel, put on your fresh clothes, and then you'll go to sleep in your fresh sheets. Once you do take the shower with the Chlorhexadine, please make sure you're not applying any makeup, lotion, powder, perfume, deodorant, or hair products, because again, we're trying to keep the skin as clean as possible. Also, no shaving of the legs 3 days leading up to your hip and knee surgery, or the armpit of your surgical side 3 days prior to that surgery. A good idea would be prepping your home before your surgery. Things we are concerned about are tripping hazards such as throw rugs. If you can roll them up and put them away, that's the best thing to do. If you have pets or toys laying around, try to have somebody assist you with their care or keeping your walkways as clear as possible. Any other obvious tripping hazards like electrical cords, please try to secure those as well. Store items that you will be using frequently in easy to reach places so you're not stooping low or trying to climb up on a step stool to reach them. Also, it's a good idea to prepare meals ahead of time or have things frozen to make it easier after surgery, and also having healthy, easy to eat snacks on hand. Think ahead on what you'll be using as far as furniture for sitting or sleeping in. For hip patients, we want to make sure that you have a bed at a good height, and that your chair is something that's firm and with good arms to help you in and out. Also, a good idea would be doing laundry ahead of time so that way you have some clean sheets and pajamas when you get home. Mainly, we're trying to make it as easy for you at home as possible. Most surgeons will want to see you within 1 to 2 weeks of your procedure. If you have not done so already, feel free to call and make that appointment today, making it one less thing for you to have to worry about after your surgery. Now let's talk about how to properly care for yourself at home. Please make sure to continue performing your home exercises twice a day. You should also be walking daily, and you should see that you're able to increase your distance as time goes on. Please make sure that you are changing positions frequently, not just laying in bed or sitting in a chair and not moving. Remembering your precautions related to your specific surgery, eating a balanced, healthy diet, increasing your fiber and drinking at least 8-ounce glasses of water a day to help lower your risk for constipation, unless you're instructed to restrict your fluid intake. Also make sure that you're eating enough protein and vitamin C. This is to help aid with your wound healing. Your incision is usually closed with internal dissolvable sutures. On the top, based on your surgery type, your incision may be closed with one of the following as pictured. Most will probably be closed with steri-strips or surgical glue. No matter what is used, please don't pick, pull, or remove anything, even if it looks like it's ready to fall off. Steri-strips and surgical glue are designed to fall off on their own. If you do have sutures or staples that need to be removed, those will be taken care of in the office by the surgeon on your follow-up visit. All we ask is that you monitor the incision for any signs and symptoms of infection, or if the incision looks like it's starting to open. Keep an eye on your incision daily, especially once it's open to air. When you first go home, you will have a dressing covering your incision. This dressing needs to stay clean and dry. If it becomes wet, take it off, as this can cause an infection. This dressing is removed on day 5, and once it is open to air, do not apply any lotion or antibiotics to the incision. The soap and water from your shower is enough to keep it clean, and please make sure to pat dry with a clean towel once you are done. Do not remove or pick at any staples, sutures, steri-strips, or skin glue. Please follow any specific instructions for incision care given to you by your surgeon. Within 2 to 3 days of your surgery, you can start showering, keeping in mind that your dressing needs to stay clean and dry. Cover your dressing to protect it. Usually some plastic and tape or saran wrap is enough to keep it dry. If it does get wet, remember to remove it to lower the risk of infection. Please have a family member or a friend help you, especially with your first shower, as you may need the extra help. No submerging underwater until your incision is fully healed, including no swimming, hot tubs, or baths. Remember your activity restrictions and precautions related to your surgery, and be mindful of falling, especially in a slippery environment. Next, we'll review signs and symptoms to look out for and to notify the physician of right away. If your incision has been having increased pain to the touch, or increased redness or warmth, any increase in drainage, whether that's blood or pus-like drainage, if that drainage smells foul, or if you notice the incision is starting to pull apart. If you're having any pain, tenderness, or swelling in your calf, that could be a sign of a blood clot. Any change in your condition, such as numbness, tingling, or weakness, or any fever greater than 101.5 or chills. If you are having any sudden shortness of breath or any type of chest pain, these are medical emergencies. Please call 911 or go to the nearest emergency room. One of the most common questions after surgery is, when will you be able to drive? If you're taking pain medication, you won't be driving. Secondly, we want to make sure that you're able to operate the car safely and able to slam on your brakes if you need to be able to bring the car to an emergency stop. Driving will depend on which side you had your surgery, your strength, your coordination, and what type of car you drive. Most patients can drive within 2 weeks, but may take up to 6 weeks. Please check in with your surgeon, as they will give you the final all clear and when you can resume driving. Returning to work can take anywhere from 4 to 6 weeks. It mainly depends on your speed of recovery, what your condition was going into surgery and coming out of it, how well you're following your orders and participating in your exercise program. And lastly, it depends on what type of work you do. If you're sitting at a desk, you're probably going to work much faster than somebody who works in construction, for example. Some key things to keep in mind. Going forward, your implant may activate a metal detector because it does have metal components. Also, make sure to let your dentist know that you've had a total joint replacement. Going forward, they may want to give you a preventative dose of antibiotic prior to doing any deep cleaning or dental work, to help prevent spread of infection to your joint. While you're in the hospital, if you need any additional support, such as nutrition, activity and exercise, maintaining a healthy weight, tobacco, alcohol, or drug cessation, or help with transportation, we can help make any referrals that are necessary for you. We also have free educational classes available to the community, which can be found at our Henry Mayo website, and those are in person or via Zoom. In order to have the best successful outcome for your surgery, if you smoke, we usually try to have you quit smoking leading into it. Smoking is harmful to your lungs, heart, and blood vessels and can significantly slow down the healing process, so it's very important that you stop smoking. If you need any help with quitting smoking, please call our tobacco cessation line at 661-253-8243. Thank you for taking the time to review this preoperative education video. If you have any questions related to the material covered in this video or anything that was not addressed, feel free to reach out to our nurse navigator at 661-200-2225. If you have any questions related to your specific surgery, please feel free to reach out to your surgeon's office.